It's time for Women Win Wisconsin, powered by our friends at Motherhood for Good. I was almost late getting the segment started here because I totally got sucked into the Motherhood for Good website, motherhoodforgood.com. Click on merch. My goodness, the amount of stuff here, Nicole, Kate. Nice to have you back. You're Kate Duffy and Nicole Slavin.
Morning.
And we'll introduce our guest, Alison Page, in just a moment here. But Nicole is in a sweatshirt that says "Go Vote," and it's in green and gold.
Oh, wait.
And
I do have a shirt on too.
Oh yes, you.
Not that anybody on the radio can see this.
Nope, but it's a Kamala Harris T-shirt and a Motherhood for Good cap. But the thing I like, Nicole, about the one you got is, again, it's not a partisan message. It just says "Go vote," and there are caps as well that just say "Vote," and there's others that just say "Support local elections."
Yes. It's about getting involved and participating in the very, very important part of our political process here.
Mm-hmm. And then there's plenty of Motherhood for Good gear as well. There's a really cool zipped hoodie and a great college style T-shirt that's there. So head over to Motherhood for Good. I got so distracted by the merch, Kate, that I forgot to go to the regular website. You said there was so much going on. You're like, just point people to the website to see what else.
Or to the Instagram even. Yeah, it's nearing October in Swing State, Wisconsin, right? So there are surrogates all over the place. There's canvas launches all over the place. There's a lot going on. So we are posting about new things nearly every day. There's going to be a ton going on this weekend. So follow along on Instagram. And we do have a couple of those. We have these DIY yard signs for kids that they can decorate and put out in your yard. We have a couple of those events coming up this weekend, one in Whitefish Bay in the Milwaukee area, one in Madison. So yeah.
Yeah. And by the way, one of our mutual friends put up a note showing that one of the kid designed signs, somebody had scrawled Trump over it. And it's like, you can have who you're going to vote for. Don't be that jerk.
Yeah.
So just want to keep that in mind. All right. So again, Motherhood for Good, really catch them on Instagram, all kinds of good stuff there. Now it's my pleasure to introduce a friend and fellow co-candidate, Alison Page, who is running for a seat in the Assembly. Nicole, do you want to kick off things by, setting up Alison to maybe describe her district and give us her story and everything?
Absolutely. We're so excited to be speaking with Alison today. She brings such an important, strong background, just personally in her life as she's running for office now. Excited to hear more about her district way on in Western Wisconsin. And Alison, please welcome to the show and tell us a little about yourself and your district.
Thanks, Nicole. Thanks, Kate. Great to see you again, Pat. First, I'll just tell you a little bit about the district. So we're talking about Western Wisconsin, the southern corner of St. Croix County, northwest corner of Pierce County. This is if you took I-94 and you were headed for St. Paul, right before you get to the Minnesota border. It's that area right there. It includes River Falls, Hudson, North Hudson, and some surrounding rural area. So it's a pretty, for our part of the state, it's a pretty tight geographical area. The area, and I would say, hallelujah and thank you to the people who worked for Fair Maps for so many hours and days and weeks, months and years. Due to the remapping, this district is much more fair now. It's a 50-50 district. It's a toss-up. It leans a little bit to the right, but over the past few elections, it's been trending a little bit to the left. So very plausibly winnable. This is not my first rodeo. I have run for office twice before, back in 2008. Pat and I teamed up a little bit. I was running for the 10th Senate District. And then again, in 2022, I ran for state assembly in what was then my assembly district, which was southern part of River Falls and to the south, very rural, very right-leaning. So here I am, third time around running for office, and this is actually winnable. So that's the district. It's a great place. It is a great place. It's one of the fastest growing areas in Wisconsin. It's a very vibrant area of the state. A lot going on, lots of changes, and a lot of exciting things.
And you've got a career in healthcare administration and nursing prior.
Yep. So I started life. I'm from a huge Catholic family, and I started life in healthcare as a nurse, and then went on to get my administrative credentials. In the last 25, 30 years, I worked as an administrator. Most recently, I was the CEO of Western Wisconsin Health. Before that, I worked for one of the big systems in Minnesota. So healthcare is my deal. That's what I do. I've worked almost everything you can do in healthcare. I've cleaned the rooms, I've delivered supplies, I've taken care of patients as a nurse's aide and as an RN, and done anything you can imagine pretty much in a hospital. So besides that, I am married to the same man for 49 years. We have 5 children. I've got 7 grandchildren, helped to raise a couple foster children in our home. So very, very involved in the lives of children, and spent a lot of years on the River Falls School Board. I'm back on the River Falls School Board now, so probably 18 years I've been on the school board, very involved in environmental issues with the land trust in the region. My mission is really to make Wisconsin a great place to live, work, and play, and a great place to raise a family. I think if we focus on families and what families need, that we will become a magnet. People will want to come and live here who have children, people who are raising children. So let's just focus on making Wisconsin a great place to raise a family. And if we do that, I think a lot of the rest of the issues that we're facing get solved.
Absolutely. And talk about why some of the policies that you are for, and really a lot of like the Democratic platform, are things that help all families and all Wisconsinites, no matter what party affiliation they're from. And I'm assuming you have things from your healthcare background too that are really important to people. What are some of those policies that are important to you that you're hearing about when you're going around the district?
Yeah, a lot of people, when I knock on doors, people just want good things for their families. They want to be able to afford to raise their children well. And how do we help them do that? Well, there's a few things. Number one starts with healthcare, with access to exceptional healthcare from when you're a kid on, that you know how to take care of your body really for the future, and support for people who are having children. And I'm talking about like the preemptive stuff, really the health and the wellness, moving upstream. At Western Wisconsin Health, that was our goal, was to move upstream before people are sick. How do we really improve the overall health and provide services for people to improve their overall health and well-being prior to getting sick? So big priority for me in healthcare, including access to mental health services, and particularly in Wisconsin, access to substance use disorder treatment for people who have addiction services, and of course, very importantly, access to women's reproductive health services. I am pro-choice. I've actually personal experience with a situation where, due to issues with a pregnancy, I made the decision to have a later term abortion. Therapeutic abortion. And so living through and making sure that all people in Wisconsin have access to the health services they need. If we do that for families, it makes it a lot better. The other thing is I will go to the mat. I'm a huge advocate for public education. Our Constitution in Wisconsin calls for the education of all children in the most equitable manner possible, and that education should be non-sectarian. So we need to support our public schools. The best and the most cost-efficient way to make sure every child gets the best education is a strong and excellent public school system. So let's do that. And then also, I would say for families, making sure that the environment is excellent, the physical environment, clean air, water, soil. We could talk about that all day. And then access to jobs. Jobs that families can live on. In my district, in the 2 counties, Pierce and St. Croix counties, 30% or more of the families are classified as ALICE, which we know is that working poor. They're working hard. They're both working hard. A gentleman whose door I knocked on the other night was in tears telling me about how he had to file bankruptcy. His wife is working, 2 jobs at very low end of the pay scale, and they can't get by. They've got, 3-4 teenage kids, and it's just a real struggle. And so big portions of our communities are struggling to just get by. So assisting families with daycare, supporting daycare, making housing more affordable. And again, that's an all-day conversation of what exactly happened in the housing market here back as far as 2008. And what do we need to do to ensure access to affordable housing going forward? That's a whole nother project. But it's that kind of thing. So, I'm in favor of business, but supporting businesses that are going to bring good jobs to the state that people can actually live on the salaries.
Well, and I love something that you said when you just at the beginning of this section when you started talking is, attacking the problem upstream and
Yep.
not waiting until the problem is there to address it. And that almost was woven into every policy thing you talked about. And I think it's such an important piece to strategic governing, right? Is
Mhm.
attack the problem before it becomes a problem, invest in communities, invest in the infrastructure that's going to allow people to thrive and build lives that, help
Yep.
them be more self-sustaining. And then we will all be a better community for it, right?
Right, right, right. All families are all our families. And, my kids, my kids aren't okay unless all children are okay.
Yeah, I think that's a fundamental piece that most of us just understand, right? It's the idea of the community and taking care of the people around you. I wanted to ask a little more. I think just you have such a unique and strong experience when it comes to rural public health and living in Green Bay here is great, but you get outside of Green Bay and very quickly healthcare access changes. And could you talk? I think those of us who live in larger cities, we just take for granted that you can just zip over to your choice of a hospital. And, if there's an emergency or you have your regular doctor that's within 10 minutes of your house. Can you talk about the impact of what's been happening with access to healthcare in rural parts of the state and your thoughts on how we could make that better and more accessible for others?
Yeah, so Western Wisconsin. So we are right on the border of Minnesota. A lot, I would say almost a third of the healthcare that's delivered to the people in Western Wisconsin in this area is delivered in Minnesota. Minnesota is the home of many exceptional healthcare organizations. I used to work for one of them. And so there is access to healthcare across the border. And we have really good healthcare in basic primary healthcare and specialty services in Western Wisconsin. Where we start to struggle is people who maybe can't cross the border for all kinds of reasons because of their coverage. We run into trouble with access to substance use disorder treatment, behavioral health services. How do people, there isn't excellent coverage for these things. How do people pay for it? How are the services designed in a way that they flex to a person's needs? For example, how do you quit your job or take time away from your job to get treatment for substance use disorder? Where are those services? Part of, everybody in the state has heard about the 2 hospitals shutting down in Chippewa and in Eau Claire. Yeah, the 2 hospitals shut down, but 15 clinics shut down with those 2 hospitals. And the substance use disorder treatment and recovery place also shut down. So there's one more resource out of the region. So how do we make that better? I mean, obviously, having people have coverage is one thing, but then having people have services accessible to them is another thing. Example of that, at Western Wisconsin Health, we built a behavioral health program. And because that organization is designated as a rural health clinic, which means it's federally funded for Medicare and Medicaid patients at cost, we are able to provide those behavioral health services to many, many people in the region who couldn't otherwise get them. Our behavioral health providers actually go into the schools and provide the behavioral health services to school districts in that area. And that's working out really well for parents, who might struggle to go take their child from school to a behavioral health appointment. How do we meet people where they are? And that's one of the key things I took away from my nursing training was we never, ever, ever judge people. And I think as moms, a lot of us, we just are that way. No offense, Pat, men are too. But we meet people where they are. We accept people. And we always think, I remember being an OB nurse and taking care of some people who I knew they were going to take this little baby home and they were going to struggle. And I just thought, if not for the grace of God, I would be there.
Yeah.
And how do we help take care of people?
Which is exactly what we should be doing, though I would hasten to add, we have a legislature that is still sitting on millions of dollars that was meant to go toward this Chippewa Valley health emergency that they're playing politics with. You want to change that? You change the legislature. That would include Alison Page's candidacy in the 30th district. Head over to pageforwardwisconsin.com to learn more. Alison Page, thanks. Good to see you again. Good luck.
Yeah.
Take care. All right.
Thank you.
Nicole, Kate, awesome as always. Go to motherhoodforgood.com or Motherhood for Good on Instagram to learn all the many events going on there. We'll catch you later.